Dr. Saurabh Joshi. I am Director and Head in Urology and Kidney Transplant in Accord Hospital, Faridabad. Today we will discuss about penile implant. So what are the patients who need penile implant? So the patient who is having erectile dysfunction, which the cause is vascular cause. It means vascular ED are the patient who is treated with all the medication but having medical failure. So there are two type of patient. First is vascular ED patient, and second is the patient who has on medical failure therapy. So both are the candidate for penile implant. So penile implant, we have two types of penile implant. First is hydraulic or 3-piece penile implant. You can see in this picture, this is 3-piece penile implant. Second is semi-rigid. Semi-rigid when there is a single rod and there is no tubes. In 3-piece there is single rod and 2 tubes. You can see here this rod, yellow rod, this is placed in the penis and reservoir placed in the abdomen, and one pump is placed in the scrotum. So when we press this pump, then there is an erection occur and patient can do sexual activity. And when there is a when excitement is over or sex is completed, here is a valve. When the patient press this valve, then the erection down. So the patient can use it whenever he need to do the sexual activity. And when there is no need of sexual activity, he simply press this button and the penile will down and he can live his normal life. So what is the age of we can do penile implant? Any age we can do penile implant. We have done in 60, 65, 70, 75 years. All are very happy and they have kids. So the 3-piece hydraulic implant is the best implant. We can implant single cylinder also, but this is semi-rigid cylinder. In this there is no tubes, only cylinder. That cylinder is malleable. So whenever he wants to do sex, he has to erect this and do sex, and when he wants to do pee or urination, he can make it down. So it's like spring and pipe, rigid pipe. So that's how we can do penile implant. Thank you.